extends from the base of skull, till the, unfortunately we have only some part of pharynx. Is it the pharynx? Yes, you see that part of pharynx not cut. Honestly, it's esophagus even. What are you doing there? Stop whispering. So this is pharynx. Pharynx extends from base of skull till the 7th cervical vertebra. So at the level where larynx ends. And we distinguish 3 parts of pharynx according to places where they situate. So upper part is behind the nasal cavity. We call it nasopharynx or nasal part. The next part behind the oral cavity, oropharynx, and behind the larynx, laryngopharynx. Or laryngeal opening. So let's start with nasopharynx. Nasopharynx. The uppermost part of the pharynx, it extends from base till the 2nd cervical vertebra. You see, it has connection with nasal cavity due to choana. Do you remember that?
Choana.
Here we have not concha, choana. Choana is here. You see, you have septa here, and choana is limited by the sphenoid bone, by the horizontal plate of palatine bone, by the vomer, and by the middle plate of pterygoid process. So it leads into nasopharynx. But when you inhale, so your air passes through the nasal cavities, through the choana to the nasopharynx and moves downward. Also, nasopharynx has one opening on its lateral wall. This one. It's a pharyngeal opening of auditory tube. It leads into the tympanic cavity of middle ear. As you remember, we studied muscular tubular canal on the temporal bone. Muscular part has muscle and tubular part has auditory tube. Also, around the pharyngeal opening, you can see some elevation. It's formed by the cartilage of its tube. Torus tubarius. It surrounds pharyngeal opening superiorly and posteriorly, so this structure. Then also in the nasopharynx we have 2 more tonsils. First one is unpaired and is present on the vault. It's not vault. No. Vault of pharynx. If I remember that term known as like that, vault. V-A-U-L-T. No? Vault.
Hidden lock.
Yeah. Vault. Yeah, it's a vault. So here we have pharyngeal tonsil. Pharyngeal tonsil which is unpaired, like tonsil of tongue. And there is one more tubular tonsil between the pharyngeal opening of auditory tube and soft palate. So it's here, pharyngeal opening, soft palate, and between them we have the tubular tonsil. Then we move downward where we have oropharynx. Unfortunately, it's a little bit destroyed here, but it's oropharynx. Anteriorly, it has fauces. By fauces, it communicates with oral cavity. Oropharynx at the level of 3rd vertebra, 3rd cervical vertebra. This is 2nd, this is 3rd one. And we go downward where we have laryngopharynx. Anteriorly, it has inlet of the larynx, laryngeal inlet, which is limited by epiglottis, by arytenoid cartilages, and by the araepiglottic fold. Just laterally to the larynx, you see some sinus, like a pouch in the pharynx, known as piriform pouch. Look, piriform pouch. That's all. Then we continue just downward into the pharynx. Now we should discuss about the wall of the pharynx.